joining us to learn and stay connected with cancer support community at this time while we are going virtual. Tonight's presentation is called Coping with Chemo, Brain, and Fatigue. My name is Gabby Ingram.
And I'm Maddie Kovacs. So what to expect for tonight? We're going to do some self-introduction so you can get to know us a little better. Some of you have been around us for the last 10 to 11 weeks that we've been here. We're also going to give an intro to occupational therapy. So those of you who've heard of it, wonderful, but we want to expand a little bit. We're going to talk about cancer-related fatigue, cancer-related cognitive impairments, which is also that chemo brain that we hear a lot. And then we're going to talk about some activities that are going to be posted for you to complete after the presentation.
So just a general introduction about kind of who we are, where we come from, why we're here. We are occupational therapy students from the University of Indianapolis. We are set to graduate in May. Yay! And we are completing our doctoral capstone experience here at Cancer Support Community. So this placement is kind of unique to the doctoral program within the occupational therapy education field. So this is a 14-week student-driven placement that really focuses on skills beyond just the basic patient care, clinical skills, although those are important. This kind of sets us up to get more into research and kind of those advanced skills going forward. We have both decided to complete this experience here at Cancer Support Community, and the staff and organization have been so welcoming and really provided us with great opportunity. So we are focusing on program development during our time here. So like Maddie said, we'll dive in a little bit deeper about ourselves and kind of our backgrounds. So again, my name is Gabby. Why I chose occupational therapy. So from a long time ago, I knew I wanted to go into kind of a people helping profession, something in healthcare, but my mom was a nurse and I knew that that wasn't necessarily the path that I wanted to take. So when I was introduced to opportunities to job shadow and get into the therapy world, I had the opportunity to shadow a lot of occupational therapists and really fell in love with what they were able to do, the different settings they can work in, and really the difference they can make in the lives of so many. So that's kind of my why. A little background about myself and my education. I came to UIndy right out of high school, so I started as an undergrad freshman at UIndy, and I completed my undergraduate there in psychology. So in 2018, I graduated with a bachelor's degree in psychology, with full well knowing that I really wanted to go to occupational therapy school at UIndy. So I wanted to go there, stay there. It's a great school. So at the fall of 2017, we started the occupational therapy program. We kind of overlapped our undergrad with our grad school program, so those years might not line up perfectly, but they didn't. And so during that time, I've been in the occupational therapy program completing coursework and clinical rotations, and as well as research. And really that research component is what led me to Cancer Support Community, which kind of goes into this. So during my time in the occupational therapy program, I did a lot of research with a group of our classmates on cancer survivorship, and we actually held our research here at CSC. And so I knew that they were so welcoming, their mission really spoke to me, and it was a population that I really wanted to help with our knowledge and skills that we learn. And so I came here with the intention to develop a program for them, which goes into my individual project. So my project is titled Survivor's Day Out. Some of you may have seen some of the different outings and groups that have kind of been built around that program. So really that program is based on leisure participation, so having fun. And so research shows that that is one of the first things to go in survivorship, just because there's a lot to handle with diagnosis, treatment, and all of those things that kind of come along with that survivorship journey. So this program is really trying to get people connected who have similar experiences out in the community, engaging in fun things, restoring that piece of themselves that is fun and social and having good leisure participation, which is actually an area that we can kind of focus on and help people with.
So then looking at my kind of background and things, again, I'm Maddie. So why I chose OT, I always knew I wanted to go into a health profession, but when I was in high school, I had an injury that led me to see 4 different occupational therapists, and I fell in love with what they can do. I had to see an occupational therapist or occupational therapists that were certified hand therapists and did a lot of the ortho stuff, and I didn't love that. But I love working with our patients and seeing patients where they can go from being in an ICU to walking back in to thank the nurses because of the care that they provided and thanking the therapist for the care that they provided. So that's a little bit of why I chose OT. A little bit of background in my education. I, again, similar to Gabby, started at the University of Indianapolis in the fall of 2014 pursuing a Bachelor of Psychology. I graduated with that degree in May of 2018, but in the fall of 2017, I started my OT career, so working in pursuing my Doctor of Occupational Therapy. During the time that I've been there, my OT research focused on pediatrics. So my research group looked at developing grasp patterns in infants. And then I've also done a lot of my own kind of research, but reading a lot of the literature on how OT can be involved with cancer survivorship and those that are currently in treatment, having to stay inpatient, things like that. So that leads me a little bit to why cancer support community. I have always been impacted by cancer in some sense. I've had many family members who have had cancer, a few who have lost their battles with cancer, but in January of 2018, my dad was actually diagnosed with cancer, and that's when it hit home really hard. I live in Johnson County, and if anyone has heard of Johnson County, we are kind of the pediatric cancer capital of Indiana. There's so many pediatric cases, and it just does not seem right. And so then when my dad was diagnosed, it hit a little closer to home, and so I decided that I needed to step up and do something. So with the knowledge that I've learned in OT school, I chose to come to Cancer Support Community. So my project at Cancer Support Community, as you can see, I love animals, especially my puppy Milo. He's a lot bigger than that now. But I created Tale of Survivorship, which is an animal-assisted program. So I partnered with Pause and Think, which is a local animal-assisted therapy organization. They go through a long evaluation process to become registered therapy dogs. And these animals can go to hospitals, some of them go into schools, things like that. But I reached out and they were super excited to come to CSC. We've had a few programs thus far. Hopefully we'll be able to get some more in before I leave, but we're hoping that we can continue the program on once I leave. So a little bit about what occupational therapy is. Normally in this presentation we're asking who knows what this is and things like that. So we're going to jump kind of right into it today. So the American Occupational Therapy Association says that occupational therapists, and I'm directly quoting, they help people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities, which are occupations. And so occupations, many people think, oh, occupation, it's my job. Well, that's part of it, but the World Federation for Occupational Therapy says that occupations are, they kind of sum it up as anything that you need to do, anything that you want to do, and anything that you are expected to do. So there's a lot that goes into these occupations, and we're going to kind of break some of those down a little bit further.
So kind of throughout our presentation, you'll hear us refer to activities of daily living or ADLs. ADLs is just the kind of acronym for this. Really, these are kind of the foundation of OT, definitely not only where we lie and where we stay. However, these are the activities that we think of that are fundamental to living, that enable us basic self-care, basic survival, and well-being. They're really activities that are oriented to taking care of ourselves. So, you know, these can look like different things, different people do them different ways, but it really includes bathing and showering, toileting and toilet hygiene, dressing, feeding, eating and swallowing, functional mobility, so kind of how you're moving about your environment, personal device care, which can look like taking care of glasses, contacts, hearing aids, any kind of orthoses or prosthetics, kind of taking care of those devices, grooming and personal hygiene, as well as sexual activity.
So delving not much deeper, but just into a different area, we have instrumental activities of daily living, so IADLs. And these IADLs are activities that support daily life within the home and community, and they often require a little bit more complex interactions than those activities of daily living that Gabby just mentioned. So some of these are the care of others. So that could be if you are a caregiver, if you watch children, things like that. Care of pets. So again, I love my animals, but I think it's something that's super important. Child rearing, communication management, which sounds kind of interesting, but that communication management is just how you send and receive and interpret different communication, and that can be face-to-face, over the telephone, through an email, through text messaging, all of that. Driving and community mobility is really big with IADLs. Financial management, health management and maintenance is important. Other ones, home establishment and management, meal preparation and cleanup of meals, religious and spiritual activities, shopping, and then safety and emergency maintenance, which are very important.
So Maddie kind of told us what occupational therapy is, and we kind of talked about different areas that occupational therapists can work on. So where is occupational therapy? Where can you find these people who are doing these things and helping us kind of do these activities and really important things in our lives? So the first one will be hospitals. So more specific places within hospitals can look like intensive care units, NICUs, which is that intensive care unit for the babies and the pediatric population, inpatient acute care, post-surgical units, you name it. OT is probably in the hospital working on it or can be called to that floor in some capacity. In this setting, occupational therapists are really focused on what that patient needs to be safe and kind of get them out of the hospital into whatever discharge environment that is set up for them. That can be home, it can be another facility, it can be a parent's, grandparents, child's house, whatever the most safe and available option is for that patient. So we're always brainstorming, trying to get them, you know, out but safe and their needs met. The next one is private clinics. So this can look like a lot of different things. However, we're really thinking of the outpatient world when we're thinking about private clinics. So whether that be outpatient pediatrics, outpatient ortho, which is kind of what Maddie was talking about with her injury, hand, arm, all of that good stuff, post-surgical stuff, knee replacements, hip replacements, all of that stuff. And this can also look like work hardening. So if there's a workman's comp injury or case, OTs can really help them look at their job, what's specific to their job and what they really need to get back to, and help them work back to that. The next one is schools. And really and the schools were focused on that pediatric, adolescent, teenage population that would fall in those age ranges. In this setting, we're really looking at the role of the student. So what does the student need to do throughout their day to be successful in an education environment? This can, like I'm saying, this can look like a lot of different things, but we can work on handwriting skills, we can work on positioning, how the student is kind of positioned within their environment, and then specifically within their seat, on the floor, however they're optimally set up to get their work done and focus. We can also assist with transitions, maybe from the classroom to recess and back. That can be hard for some kiddos, so OT is always there to brainstorm with the teacher and other members of the education world to help that student get through the day and the best they can and to the best of their benefit. The next one is skilled nursing facilities. Oops, that's okay. Spoiler! So within skilled nursing facilities, we're obviously focused on that adult or geriatric population, and really we're looking at whether that patient or that individual is a resident of that facility, or if they're just staying there to get some extra rehab before they go home. Like I said, they could come from a hospital and then go to skilled nursing and then to home. So really we're focused on what that person needs and kind of what their plan of care looks like. But really, endurance, quality of life, positioning, wheelchair management, different things like that. Really just preventing decline, focusing on safety, all of that good stuff with the older adults and just general adult population. The next one, as we see, is home health. So this would be where an OT is going into people's homes and really seeing them function and hopefully thrive in their own environment or that of a family member, whatever that situation might be. So a lot of times when we think of home health, we're thinking of a continuation of some other service, although it can be just established at home in and of itself. But we're looking at people and working with people who are deemed homebound. So they're really the safest option for them is to be within their home, not traveling out to outpatient clinics, whether that be for energy purposes, for safety purposes, just kind of dynamics of the family. So different options there while we can see you in home health. But in that environment, we are looking at the person and how they're functioning safely and independently within their home. So this is a really great opportunity for the OTs and the other rehab professionals to brainstorm, provide any adaptive equipment, any home modifications, tips or tricks that can help them be more safe throughout their environment. Really gives us an opportunity to kind of show our skills and really brainstorm with each other, the patient, etc. The last one we'll talk about, which of course is not the last option, OTs can be in many other places, but is the community-based setting. So an example of this is CSC, because it is a community organization and kind of gives you guys reference of what community-based, what we mean by that. So really it's just an organization in the community that, our doors are open to the community at large. So people out, live in their lives in the community, at home, whatever that might look like. Another example, aside from CSC that I can think of, are a lot of mental health clinics that are community-based. So you can go kind of find OTs in that setting as well. Again, like I said, this is definitely not an all-encompassing list. OTs can be found in many different environments and settings, and really there's still a lot of practitioners themselves as well as students brainstorming other opportunities for OT and kind of still expanding our reach and kind of advocating for our role in different settings.
So now looking at some occupational therapy interventions related to cancer survivorships, so things that occupational therapists can help those affected by cancer with. And this is a long list, but again, similar to what Gabby said, it's not all encompassing. OTs can do so much. There's such a broad spectrum that this is just a few of the basic. So the first one is upper extremity impairments, and that could be due to an injury. It could be something that was due to your cancer, things like that. We also have chemo-induced peripheral neuropathy, so that feeling of tingling and numbness in your fingers and arms and then your toes as well, and working on how we can continue those activities of daily living while now living with this neuropathy because my nerves have been damaged because of the chemo or because of the radiation or whatever is causing it. Cancer-related fatigue, which we're going to cover in pretty big detail tonight. Fall prevention, and so this can be after receiving treatments, balance can be off. Sometimes we try and get up too fast and we don't have the energy to get up that fast and we get very dizzy and there's the fall. So working on in the home or in the community how we can prevent overall falls. Cognitive function impairment, and that chemo brain term that we'll wrap back around to later tonight. Lymphedema. This one is especially known in breast cancer patients and those who have had mastectomies and other surgeries. But it is important to note that with lymphedema, while we say occupational therapists can work with those patients and with lymphedema itself, it's important to note that you do have to have a specialty certification to do any of the wrapping techniques and to do most of the treatment of lymphedema. So some OTs may tell you that they cannot treat it. It's because not everyone has that certification. There's a lot of hours and a lot of requirements to get that certification. So we also have our overall physical health. Obviously, it's important to be physically healthy, so that's one. And then our last one is mental health. And this is one that is coming a lot more to the forefront of everything, which is very important because we know that if we're trying to hide all of these emotions and all of this, especially after a cancer diagnosis or things like that, it can be extremely difficult. So we OTs can really help with that mental health aspect.
No worries. So kind of the topic of the night and kind of what we've all been waiting for. Tonight we're going to talk about cancer-related fatigue and the cancer-related cognitive impairments, or chemo brain, as Maddie has kind of alluded to. We are going to talk about these two topics separately. However, it is really important to note that they are can happen at the same time and kind of have a dynamic relationship in that way. So that means just one can affect the other and vice versa. So it's really important to note that we will talk about them separately, but some may experience both to some degree. So with cancer-related fatigue, just kind of some background information about it. It is one of the most common and distressing side effects of a cancer diagnosis and of treatment. It can last months to years post-treatment. So some may experience just, an acute, while I was in treatment, I experienced this, but not afterwards. Some people may not experience it during treatment, but afterwards, and kind of be like, this came out of nowhere, what's going on? Or they can experience it all of the above. And again, it can last for quite some time after treatment. This kind of fatigue is not proportional to recent activity. So this is really important to note. It might not be that I woke up at 6 a.m. and I cleaned my house and I, went for a jog, walked my dog, etc. and now I'm so tired. It might be that you woke up and you are exhausted. Maybe that's because you didn't get enough night's sleep, or maybe it's just because of this underlying fatigue that is really prevalent within cancer diagnosis and treatment. So kind of with this, just don't always think, it's related to that activity. Sleep or rest does not always provide relief, although it can help to some degree, listening to your body, taking naps, resting, etc. However, you may not always get relief from that. And then it does interfere with usual functioning, so kind of those occupations that we alluded to. And it is kind of important to note, just as a statistic, kind of about how common this is that between 70 and 100% of patients experience cancer-related fatigue at some point during their survivorship experience. So if this is you, one, know that you're not alone. Two, know that there are other people experiencing it, and it's real. What you're feeling is real. So looking into different areas of our life that can be impacted or influenced by cancer-related fatigue. So really, like I said, it's our occupations, and Maddie kind of defined that for us earlier, those things we want to do, need to do, or are expected to do. So all of those normal day-to-day activities. So these here listed on the screen are just a couple that we'll dive a little deeper into. So work being the first one, that can be affected, one, by all of the complexities surrounding treatment. So maybe you're having to adjust your work hours to go get the treatment that you'll kind of is in your healthcare plan. Maybe you're having to take time completely off of work to go and kind of take care of whatever that treatment or those options look like in your individual case. Work can also be affected by fatigue if we just can't, it's impacting us and we just can't perform our job duties as maybe well or to the capacity, or maybe kind of doing all the things, running around that we may have used to be able to. And this can really drum up some difficult conversations, however necessary conversations between you and a coworker or you and a supervisor. Those can, again, be really hard, but typically people are going to be understanding and kind of work with you in that way. However, when work is affected, when we're having to take off hours, adjust hours, etc., that can, influence our finances and our financial management and what that can look like. So that can really be an area that's affected and is actually really very well researched in the cancer survivorship world. The next is social relationships. So, very blatantly put, when we're tired and we don't feel rested or kind of ourselves, we're grumpy, and maybe not all that pleasant to be around. I know I'm definitely not pleasant to be around when I'm grumpy. So those social relationships can be impacted that way, which kind of links to mood. So these are kind of interworking in that way. However, social relationships can also be affected. Maybe we don't have the energy to go out and do those regular leisure activities or those social activities that we once were able to do. Going out to eat with a spouse, friends, Wednesday night card club, whatever that might look like for you. Maybe the energy and the fatigue is just really impacting that area of your life. With mood, kind of like I alluded to, when we're grumpy or when we're fatigued, we are grumpy. So that can definitely, fatigue can impact that area of our life. However, it, just being kind of candid in those conversations and, telling those people, hey, I'm sorry, don't take this personally, but I'm just not feeling myself or just not, up to it today. I'm sure the people in your life will definitely understand that. Although, again, those conversations can be difficult. And then kind of to sum it all up, our daily activities are and can be affected by cancer-related fatigue. So kind of those, we commonly hear, I'm just too tired to take a shower, which is a real concern and very, valid, and things that we can do to brainstorm kind of the scheduling of that event or whatever that might be. It can impact the way that we clean our homes, engage with others, take care of ourselves, our pets, other people, etc. So that is kind of, again, not all the ways that cancer-related fatigue can impact our daily lives, but just some examples. So some treatment strategies to kind of curb these effects and, the fatigue that we may experience. So it is really important to note that there is no gold standard of treatment. There's no recipe that if you do this, you'll not experience fatigue or you'll be relieved of it. But these are some different things that we can do to kind of alleviate it or minimize it. So the first is physical activity, which sounds kind of counterintuitive, possibly, But the more that we move our bodies, the more energy we can get, and that fatigue will relax. So the American College of Sports Medicine recommends moderate intensity aerobic exercise for cancer survivors. So what moderate activity looks like from person to person can be very different. So really with this, it's important that you connect with your healthcare providers, your therapy team, different people on your healthcare team to really brainstorm what this looks like for you. Examples of the aerobic activity that we kind of allude to and is recommended by this entity would be things like cardio machines, spinning, biking, running, walking, hiking, swimming. Seems like anything with an ing. Kickboxing is one as well, which doesn't come to mind right away for me, but is a really good option. Also rowing, which Cancer Support Community actually has Rowing for Wellness, so a little shameless plug there. So when we're out of this virtual world and we can kind of re-engage, that's something to keep in mind that is offered right here at Cancer Support Community. Again, talk to your healthcare providers, see what's good, what's recommended for you. The next one would be the psychosocial techniques that we can use. So this can look like yoga, mindfulness exercises, meditation, acupuncture, massage. So again, plug for CSC. We now have massage here at our West 71st Street location. So definitely call the office and get scheduled there. So that is another technique, as well as support groups. So support groups can be really helpful to share best practices, brainstorm, just feel connected to others, kind of that social relationships piece of things that we talked about on the previous slide. The next one is pharmaceutical. Oh, sorry, I skipped one. Mind body. Yeah, sorry, that goes with psychosocial. So the mind, body, and psychosocial are one piece together, and I kind of lumped them together. So pharmacological is our next one. So with this, according to some research, there are, some different pharmaceutical medicines and different techniques that people can use to maybe curb fatigue, or maybe it's the interaction between some that is, encouraging the fatigue or intensifying the fatigue. Really, I'm going to leave this up to the medical professionals. We come from the therapy world, so this is not an area that we are very knowledgeable or have much skill in. So really we would encourage you to talk to your oncologist, talk to your family doctor, whatever that looks like for you, and get tips, ask questions, but that's definitely a conversation maybe worth having. Some other helpful tips to consider would be things like delegating tasks, which we'll kind of go into a little deeper. But think of delegating it to your spouse or partner, children, grandchildren, neighbor kids, whatever your social support system looks like that you can delegate tasks to, do it. Those people are wanting to, probably asking how they can help. So let them help, and that will save you some energy as well. The next one would be eating well. So make sure that, you're keeping a nutritious diet, you're snacking on foods that are healthy. I know a lot of times during survivorship, your appetite isn't the same, things don't taste the same. However, it is really important that you're still getting those nutrients, and that healthy diet and eating well will give you more energy. So this could look like getting in touch with a dietitian or nutritionist to kind of get a healthy eating plan in place for you. They'll, I'm sure, work with you on things that you like and don't like and brainstorm with you in that way. However, eating well is definitely very important and helps our bodies kind of fight different things as well. The last one that I will share is, as a treatment strategy, is good sleep habits. So this is really just ensuring that we get a good restful night's sleep, setting ourselves up for the best rest that we can get by turning off the TV, making sure our environment is as comfortable as possible, whether that be with noise, without noise, the lighting, different apps and different tricks that we can use to really get a good night's rest. With napping, I know that kind of talking fatigue, I'm tired, I really want to nap, that can be kind of a downward spiral, so we always kind of suggest that if you're going to nap, try to keep it to under 1 hour. So that will give your body some really quality time to rest, but also, get up and do something during the day, because again, physical activity and moving around can really give your body some energy, which I would like to also touch on. Physical activity does not always mean exercise. It doesn't mean you're out there running miles or walking miles. It can really just be going to the grocery store. It can be putting your groceries away, loading the laundry, folding the laundry, whatever that can look like. Physical activity is your body moving. So you can definitely kind of piece together the things you need to do during your day and still get that physical activity that is recommended. So that is that. The next slide we have here is kind of the role of occupational therapy within cancer-related fatigue. So kind of what is our role in this, and why we kind of speak about it and learn about it. So the first one is energy conservation education, which I think is super important, and we'll kind of break that down here. So a good general rule of thumb is to just think about your energy as a bank. So think about those transactions that you make. So what you spend, what you restore, what you save, all has to kind of equal out at the end of the day, at the end of your week, and so on. So really you want to make sure that you're not overdrawing your energy bank. So kind of that's a good general rule, simple way of thinking about it. So how do we do that? How do we make sure that we're not overdrawing ourselves? There's a technique called the 4 Ps of energy conservation. So they are prioritize, plan, pace, and position. So breaking those down further. With prioritize, this means that you're really prioritizing what needs to be done. What needs to be done today versus this week versus this month, whatever that kind of looks like. So prioritizing yourself and what you have on your to-do list. So with this, you're really thinking of the order of importance and maybe those deadlines associated to activities. So definitely think about what I got to do today and what can flow into tomorrow, what I have to do this week, what can flow into next week, etc. The next one is plan. So with this, plan to gather items that you're going to be using at one time. So you're not making a million trips back and forth from maybe the kitchen to the cupboard to the pantry, back to the kitchen, etc., whatever your home layout might look like. So with this, we always use the example of baking brownies. So think of, you're going to the refrigerator, maybe to grab the eggs. Before you run them to the stove, maybe go to the cabinet, grab the oil and the brownie mix. While you're there, grab the bowl, put it all in the bowl so you can efficiently carry it and not drop anything, and carry that to the stove, kind of all in one fell swoop, kind of one trip. That will save yourself from running to the refrigerator, to the stove, to the cupboard, back and forth. Save your energy that way. Also with plan, try to plan activities that are really heavy work, followed up by lighter activities. So obviously prioritize, right? Stick to that first P, but within that, plan. So plan to, do something pretty taxing, or what your body is telling you is taxing, followed up by something lighter that you might be able to sit during. That can really help you kind of restore some energy, yet still feeling like you're getting something done and being productive in that way. Also with plan to get a good night's rest, which kind of speaks to the other point that we've made. Definitely getting a good night's rest is going to help you conserve energy, restore energy, and really set you up for success going into the next day. The next P is pace. So pace yourself, know your limits, listen to your body, take frequent breaks throughout your day, throughout each individual activity. Nobody's in a rush, although I know the world wants to tell us we're in a rush, but kind of try to pace yourself, slow and steady wins the race, all of that good stuff. While thinking of this, think of ways that you can take breaks. Maybe you're cooking something, stirring a pot at the stove or something, but maybe while it's boiling, you can pull up a chair and take a rest. look at different ways that you can take breaks throughout your day. Pace yourself throughout your day. The next one is position, which I kind of alluded to. This is really looking at your body's position. So thinking of, when am I standing, that's consuming energy. When am I bending over, reaching, lifting, all of that is consuming more energy than we probably realize. So anytime that you can sit during an activity is really kind of ideal and can save up to 25% of your energy during that activity. So really try to avoid that reaching, bending, stretching, lifting, all of those different body positions really take up energy because our body is having to go through all of those postures. So again, sit when you can, whether this is in the shower, at the stove, while you're washing dishes. Of course, always be safe. Don't trip around the chair that you've set up for yourself, forgetting that it's there, but definitely a good tip and a small thing that we can do in our day that can really save us a lot of energy. The next one would be kind of going along with the conservation of energy, is kind of timing out our day and kind of the time of day that we do our different activities. So examples of this is that if a shower takes all of your energy away from you and you do that in the morning, so you have no energy for the rest of your day, try to shift that to maybe your evening. Or maybe put your shower at the beginning of your day, but leave a block to where you can rest and kind of restore some of that energy. So really looking at that timing of when we're doing the activities. Also with this, maybe try to, if you're cleaning your home or doing different activities like that, try to vacuum or sweep maybe one room at a time. One room per day, one room in the morning and then another one in the evening. However that looks like for you, for the energy that you kind of know that your body has. Again, with this, definitely listen to your body, know your limits. It's screaming at you for a reason, and you definitely don't want to overdraw your energy bank. So keep that in mind. With the environmental and adaptations and modifications, this is really kind of an area that occupational therapists can thrive in and really make some creative brainstorming opportunities with you and that individual. So with this, we're really looking at how you are functioning in your environment and how we can change the environment to help your energy and kind of curb that fatigue in that way. So we're definitely not asking the person to change because, we don't want people to change. We want to change the environment to fit the person. So with this, we can look at grab bars, shower chairs, different things like that, different equipment that we can use to increase our safety, decrease that fall risk that Maddie kind of alluded to, but also limit that bending, stretching, reaching, all of those things that are consuming a lot of our energy. Also with this, we're looking at kind of the organization throughout your home. So we kind of use the example of baking brownies. So if you do that frequently, or whatever you cook, whatever that might look like, the dishes and the ingredients that you use frequently, we're going to want to put those in the lower cabinets. So we're not having to constantly reach up, get that stool out and reach above the refrigerator and, really put our body through all that stress when we're repetitively cooking those items and using those different household equipments and ingredients. So we would maybe make the recommendation that you reorganize a little bit and we could brainstorm that process with you. With this too, we are, really looking at safety and independence, like I said. That is definitely the top of the, kind of list of the environmental, kind of our motive there. The last one we have here is maximizing independence with ADLs. So those activities of daily living, those basic activities that we do every day, we're really trying to maximize our independence while also keeping the fatigue levels in mind. So with this, obviously the factors and the different ways that we go about our activities, the different activities that are involved in our daily routines can look different from person to person, but we can help you with activities like bathing, dressing, toileting, all of those different things. We can help you make suggestions for the adaptations, the different equipment and stuff that might help performance in that way and really increase safety, again, like I said. Overall, the role of occupational therapy and cancer-related fatigue is really just being there for you, knowing that what you're experiencing is real, and maybe we haven't experienced it ourselves, but we probably have worked with someone or know someone that has experienced it, and we can kind of brainstorm best practices that we've learned with you, and really just know that we're on your team to support you. And if we don't have the answers, we can probably find someone that does have the answers. So definitely OT is there in that way.
All right. So that was cancer-related fatigue. Now we're going to move more into the cancer-related cognitive impairments, that chemo brain term that we hear so often in the media and sometimes in movies and books, and kind of in all of everything that we hear. So what's important to note, and I'm going to say this multiple times throughout this portion of the presentation, you do not have to have undergone chemo to have chemo brain. Chemo brain is kind of a term that was just coined because, oh, you've had chemo, yeah, your memory's not as great, you have chemo brain. But really, it's just the cancer-related cognitive impairments. And so we're going to use that longer term tonight throughout the presentation because we want people to understand you don't have to have undergone chemo to have these cognitive impairments. You don't even have to have undergone radiation or surgery. So some kind of different things about chemo brain. It is a very prevalent side effect of cancer treatments and some cancers themselves. It can be immediate, but it can also linger in some cases. And for some of those cases, it lingers for quite a while. Some people, I've had people ask, does it ever go away? And it's hard to say because everyone is so different. So some examples of these cancer-related cognitive impairments: difficulty remembering common things. The name of that street that is 2 streets over and you go there all the time, or difficulty remembering the path to your grocery store, things like that. Difficulty focusing, so you sit down to do a task and you just cannot stay focused. Difficulty multitasking, we put this one on here, but there's a lot of research that shows that as humans, we cannot multitask. In today's world and society, we're told we have to be doing so many things at once. So we say, oh yeah, I can multitask. But if I'm doing one thing and have something in the background, I'm focusing on one thing while I have something in the background. It doesn't matter what that is. I can't give equal focus to both things. So that one's just kind of, it is there, but with a little side note. And then memory lapses. So you're talking and all of a sudden you can't remember a word, or you just cannot remember what you ate for breakfast this morning, things like that. So delving a little bit deeper, some areas affected by chemo brain, our memory can be pretty highly affected, and that's, we hear that cancer-related cognitive impairments, the first thing a lot of people think about is memory. It can be short-term memory, it can be long-term memory. Did I remember to go let my neighbor's dog out because I'm watching the dog for the day while she's on a day trip, or whatever it could be? And so these can be affected because you're having difficulty remembering some of those common things, the dates, the names, the places, routines, all of these things that you need. The next one is our daily activities. So looking at how do we remember these common things of the routines and all of these things. Did I get up this morning and instead of getting up, brushing my teeth, and then going to the kitchen, did I get up and go to the kitchen and, oh, I forgot to brush my teeth? Things like that. Work can be affected. This one can be challenging because with undergoing the chemo or radiation, any treatments that you may have or any side effects that you could have from the cancer or treatment, sometimes we do have to take time off of work, and then getting back into the routine can be challenging. But a lot of times work can be impacted because of the difficulty multitasking, difficulty staying focused on one thing. If you work in an office where there are a lot of people in a small space, I really need to focus on this. I need to give my full attention, but I'm hearing 3 conversations over here and 3 conversations over here. And did I just hear football back there? You know, I need to try and stay focused. Also, kind of difficulty remembering daily things. So if you've been off the job for a little while, or even if you've been on the job, but you start to forget the little things of, oh, we have a 10 o'clock meeting every day, but it's not on my calendar because it's a 10 o'clock meeting every day. Why would I put a note to myself that I have to go? Oh, it's 10:15. Don't I have a meeting? So just kind of remembering all of the little aspects. Next is looking at mood. Simply put, when we start to forget things and can't focus and our life just seems to shift a little bit, we start to get upset and have feelings of irritability. Sometimes it can cause depression, anxiety, things like that. And so it's not just, oh, I'm forgetful. It affects a lot. Excuse me. It can also affect safety. And safety is one of those things that as OTs, we want to make sure that everyone is so safe. But with safety, maybe you're cooking your brownies and you forgot to turn off the oven after you pulled the brownies out. And so the oven is on and you come back 2 hours later and oh my goodness, the oven is still on. Why is it still on? So just looking at safety, small safety aspects like that we say are small, but they actually are really large. We also, social interactions can be affected because only you truly understand what your mind is like and what you're going through. And so as future occupational therapists, we may say, well, we understand what you're going through. And we may understand in a slight sense, but our brains are not the same. Our brains are not the same as yours. And so it's important to know that, you know, while people may say, oh, we understand what you're going through, or, you know, for some of those social relationships, oh, you're not in treatment anymore. Why are you still having these memory lapses? Why are you XYZ? And so it's important to try and keep those social relationships very active and keep, you know, participating in things to keep your brain sharp. Looking at some treatment strategies, we have quite a few that you can do to kind of help. And we say treatment strategies, but really it's just things you can do to help your brain. And the first one is keep a calendar or a planner. So many of the planners and calendars today have where you have this, where it's just your full month, but then you open it up and it's by the day. And you can write out everything that you have to do. I have a doctor's appointment at 10:30. I'm having lunch with my friend at 12:30 after my appointment. Or I need to remember on here, it says birthday, book club, different things like that where you can see, oh, I need to send this person a message or call them and say happy birthday. Kind of things like that. And just keeping yourself more in shape mentally by having stuff written down. I know I'm an iPhone user, but all of the cell phones today have a calendar app where you can go in and put everything in. Set reminders of 2 hours before this event. I want a reminder that, oh, I need to go get ready because I have to go to this event. Things like that. The next one is follow routines. So this one can also go with the fatigue. You know, these things go hand in hand sometimes. And so with these routines, you don't have to get up every day and do the exact same thing because you don't typically do that. You know, you don't go to the grocery store every day. You don't go to the library every day, although some people might. But get up at a similar time every day. Try and keep that sleep-wake cycle the same. You want to get up around the same time and go to sleep around the same time. We understand that sometimes weekends or days off can throw that off, but try not to change it much more than an hour just to keep your routines normal, to keep your brain functioning normally. With that, it's also important to try and keep those meal times similar. So maybe if you're like me, you're not a huge breakfast person, but by the time mid-morning hits, I need just a little pick-me-up of a banana, an apple, something light that I can eat before, that'll carry me over until lunch. But make sure that, lunchtime around the same time every day. Dinner or supper, same time every day. Trying to keep that similar will also then help to keep that sleep-wake cycle similar. Exercise your brain. So many times we think about exercise and we're running, jogging, swimming, biking, hiking, the activities that Gabby talked about earlier of that moderate intensity aerobic exercise, but we don't think about, well, I need to exercise my brain. It's working for me, it's making me do all of these things. So when you exercise your brain, it can be things like puzzles and mazes and I know I play words with friends so that I'm in a competition with someone, but it's a healthy competition. I know that there's a lot of games too that you can download an app and it's just a game where you play against yourself. If you feel like the competition is a little too much or you tend to get too involved in the competition, so many things you can do to exercise your brain. Similarly, staying physically active. So we understand that sometimes it can be challenging to stay physically active, but as Gabby mentioned, it can be going to the grocery store. Or if you use some of the apps now where you order your food and they bring it out to you and then you get home and you have to unload all of those groceries. That can be your activity. But for some, it's, I need to go run 3 miles. Not me. I need to go run 3 miles, or I need to go for an hour-long walk. Whatever it is, try and stay active. Keep that level of activity that you had before all of this. Next is one that can be challenging, but it's don't be afraid to ask for help. No one likes to ask for help. I know firsthand, and I don't think Gabby does. It's just not human nature to want to ask for help. But a lot of times our support systems that are behind us want to help us, but sometimes they don't know how to ask because they don't want to come off as rude or, well, I know you need help, but I don't want to point out that you need help. If we can ask for help with little things, and this can be, hey, I need some help just writing down in my planner. You are great at memorizing family birthdays and big events. Can you help me jot down all of those notes in my planner or put them in my phone? Whatever it may be, don't be afraid to ask for help. The next one is also hard because we don't like thinking about our difficulties. And so when we have these cancer-related cognitive impairments, we don't want to be like, oh yeah, I'm not remembering things. But if you can track your difficulties, what are the things you're having the most difficulty with? Is it staying focused? Is it memory? Is it, word finding? Is it happening at a similar time every day? Or is it very sporadic? Is it happening when I'm trying to do a lot of things? Or is it, when I'm just trying to focus on one thing and suddenly I'm starting to feel overwhelmed by this one thing? Track those difficulties and talk to your doctor about them. Sometimes the medications that you're on can cause some of these difficulties. So if your team knows that, oh, we're seeing a lot of these difficulties, can we change the medication? Or some medications can help. But again, you want to talk with your medical team about that. And then finally, we have meditation. And so this one is important because doing that simple meditation can actually help to increase the neuroplasticity of a brain. So that ability of your brain to change throughout the whole life. So, we say that, certain parts of the brain lead to certain things or intercept certain things. but it's always changing in minor ways. So doing this meditation can help with that. And then doing some, like being mindful and doing mindfulness activities and exercises can also help to reduce stress, anxiety, depression, which are some of those things that this cancer-related cognitive impairments can help to bring on. So doing that meditation and mindfulness helps to give a little bit of ease with that. So the role of occupational therapy with chemo brain or cancer-related cognitive impairments. One of the ones that's kind of similar with Gabby's is memory strategies and techniques. So with the fatigue, it's, being repetitive. And with memory strategies and techniques, doing things repetitively is so important. And this can look like a lot of different things. It can be training on one specific task. If you work and are forgetting things, let's train on this one specific task over and over and do just some of that memory stuff. It can also be environmental cues, posting reminders, putting on the door, did you remember your lunchbox today? Or you have an appointment after work, or, whatever it happens to be. The next one is establishing safety in common environments. This one can be similar to those memory strategies. I like to think of on the stovetop. Did I, after I finished my macaroni and cheese, like after the pasta came off, did I turn off the stovetop? Or when I baked my brownies, did I turn off the oven? Put a Post-it note there or set an extra timer that when it goes off, you're like, yes, I need to turn this off because of the safety in the environment. Similarly, at night, did I make sure that my doors are locked and things like that? Does my family know my safety routine and everything that, I have going on? Next is creating routines. So we talked about the importance of having those set common routines. But with creating routines, it doesn't always have to be, like I said, it doesn't have to be creating the same routine for every day of the week. But creating routines, scheduling it out, putting on a calendar your leisure activity, because we don't want to see you not participating in leisure. And with the leisure, that can be, I'm going to have family game night, so I'm going to invite over more family members, or we're just going to play as a family, we're going to do some board games. You're getting in leisure, and you're getting in some of that brain exercise because you're having to think about these board games or the puzzles that you're doing, things like that. And you want to, with those routines, also have in there your ADLs, those activities of daily living, the instrumental activities of daily living, everything that's important to you. So kind of putting the pieces together. In occupational therapy, a lot of times we say we're kind of trying to put those pieces together. Putting the pieces together here, occupational therapists, again, are someone that you can talk to who understands that your struggle is real. We may not have the same struggle or have been through the same struggle, but we know what you're talking about is real. And we can also then, if you're working with an OT, we can make interdisciplinary recommendations. So if we see we're working with you, but we see that, maybe we should talk to the social worker about getting these services or getting this adaptive equipment. Talk to the physical therapist, speech therapist, your medical team, however we can do that, making sure that we are kind of bringing everything together, making sure that it's all looking at you as a whole person. So we have a few activities. Some different activity sheets that I'm going to quickly go through just to talk about some of the things that you can do for cancer-related fatigue and cancer-related cognitive impairments. So when we're looking at cancer-related fatigue, we have a daily activity diary, and these are all going to be posted online after the video, so you'll have access to all of them. But this daily activity diary, you can go in and write down, okay, I did this and this from this time, and then, maybe that's why I'm tired when I get to 5 o'clock, because I did so much through the day Maybe tomorrow, can I do little, take a break, little, take a break, things like that. So we have this. You can also use this to track those memory difficulties or those cognitive difficulties you're having and say, okay, Monday from 11 to 12, I really was struggling to find words. Whatever. You can use this and then take it to your doctor and say, hey, this is what I'm struggling with. The next thing that we have is a most important contacts list. So if you're struggling to remember some of those people that, or the information of some of the people that are important, writing them down, taking time. This one has the room for their name, address, phone, email, and notes. I know a lot of the smartphones now also have, you have your contacts, but you can also mark people as emergency contacts. And so if you do that, if there ever is an emergency, first responders can get into your phone, can notify your loved ones or whomever it is that you have as those emergency contacts. The next couple of things that we have a couple of daily planners, so you can kind of schedule your day for hour by hour. You can put some goals, a to-do list. Both of these track water and have room for meal planning, and talk a little bit about exercise, so things that you've done that way. We also have weekly planners. So again, maybe if I don't want to go hour by hour daily, but I have things during the week, I can put them, okay, this time on this day, I have X, Y, and Z. You need to get there. So you have just some weekly planners.
And you could use both of those, a daily planner and a weekly planner, so you have kind of a small picture and as well as a big picture on what to expect, how to plan, etc.
So then the other activities that we have, we'll kind of go through and show you what we have, but they're more of those brain teasers and exercising your brain and the mind. So we have just kind of it's a medium level maze, so working your way through the maze. If anyone likes numbers, I'm not a numbers person, but we have Sudoku. We'll also post the answer key for this one. So if you really want to try it, but oh my goodness, I don't like numbers, or you have an answer key. Yeah, or if you get stuck, you have an answer key. You want to do those?
These are word searches. We have 3 different versions of these. A CSC one, so a little bit more about our organization and kind of activities and different things like that. There is a candy bar word search, so different fun treats and different, so you can dream about all of the sweet treats. And then a Brene Brown inspirational word search. So this is really good to focus on kind of those happy things, and it's actually probably a really good mindfulness activity because you're like, happiness, where's happiness? Or courage, enough, greatly, different words that are really positive, and you can kind of marinate and meditate on those a bit. Yeah. And then too, we have crossword puzzles. So we have a football themed one that we don't have an answer key to, but there is a website down here that you could access the answer key if you would get stuck on that. And then we have a state capitals answer key that I believe we have the solution sheet for. And actually we've heard people say, that wasn't the one I was expecting to get stuck on, but it really got me. So that solution sheet might help you in that way. Other than these, we will send out also a mindfulness example that comes from a resource, a mindfulness journal that resource will be at the bottom. So if you really like that activity, we can give you that resource there at the bottom, and that's really just kind of a introduction maybe of a mindfulness example, and if you love it, you can pursue it further. If it's not for you, then you tried, and that's all you can do. So all in all tonight, if you have questions about the presentation, about occupational therapy, about whatever it might be, please email us. Our emails are down here. It's Gabby@cancersupportindy.org and Maddie@cancersupportindy.org. We are would love to see you in our inbox. Throw us out helpful tips that you found. If you're seeking more information or deeper resources, we can get it to you or point you in the direction for someone else to provide it to you if it's not something we have. Otherwise, if you would be so kind, please comment below so that we can help CSC track who we're reaching during this presentation. So if you want to maybe comment OT, capital O, capital T for occupational therapy, because that is our passion and kind of our future. And hopefully you can, use the knowledge that you've gained tonight in that way. As well, if you would like to email us, if you're not a public commenter, we totally understand. You can email us as well and say, hey, I saw your presentation, whatever, if you want to share happy thoughts or constructive criticism, whatever, we'll take it. We'd love to hear from you. So again, thank you for your time. Thank you for staying connected, especially during this virtual world right now.
Yeah, I'm just going to point out we do have references listed on here, so we didn't just make up this information. We took it from valid references and resources. So thank you for joining us tonight, and hopefully we'll see you soon.